We're very pleased that you're considering Plegridy for intramuscular injection, or that you and your healthcare provider have decided to begin therapy with Plegridy for intramuscular injection. This video will help you understand how to inject your every 2 weeks dose of Plegridy into the muscle using the single-dose Plegridy pre-filled syringe for intramuscular use. If you are using Plegridy for the first time, you should use a Plegridy titration kit with the Plegridy pre-filled syringe for intramuscular injection to slowly adjust your dose when you begin treatment. Before you use your Plegridy pre-filled syringe for the first time, your healthcare provider should show you or your caregiver how to prepare and inject your Plegridy pre-filled syringe the right way. You'll also want to read the instructions for use before using your Plegridy titration kit or your Plegridy pre-filled syringe, and each time you get a refill, there may be new information. The instructions for use can be found in your Plegridy titration kit and Plegridy intramuscular pre-filled syringe administration dose pack carton, and can also be downloaded from Plegridy.com. Your Plegridy welcome kit also contains a Plegridy injection training guide. You should carefully review the section about the Plegridy pre-filled syringe for intramuscular use before your first injection. Note that there are different instructions for use for injecting Plegridy pre-filled syringe for subcutaneous injection. Be sure that you are referring to the correct instructions. This information does not take the place of talking to your healthcare provider about your medical condition or your treatment. In the days leading up to and after you administer your dose of Plegridy, stay well hydrated by drinking plenty of water. This may help manage flu-like symptoms associated with treatment. You can also ask your healthcare provider if taking over-the-counter pain and fever reducers may help as well. The things we're going to focus on are storing and handling Plegridy, getting ready for your injection with the Plegridy pre-filled syringe for intramuscular injection, starting treatment with the Plegridy titration kit and Plegridy pre-filled syringe, giving the injection, and what to do after the injection. Now, let's get started. As you begin treatment with Plegridy, there are some important things to keep in mind. Because the tip of the cap of the Plegridy pre-filled syringe for intramuscular use is made of natural rubber latex, it is important that you tell your healthcare provider if you are allergic to rubber or latex before you take your first dose. Store Plegridy in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit, or between 2 degrees Celsius to 8 degrees Celsius. If a refrigerator is not available, Plegridy may be stored at room temperature up to 77 degrees Fahrenheit or up to 25 degrees Celsius for up to 30 days in total. You can store your Plegridy pre-filled syringe at room temperature and then put it back in the refrigerator. Do not freeze Plegridy. Do not use Plegridy that has been frozen. Store Plegridy in the original carton to protect it from light. Always use a new, unopened Plegridy pre-filled syringe and needle for each injection. Do not reuse your Plegridy pre-filled syringe or needles. Each Plegridy pre-filled syringe can be used one time only. Do not use more than one Plegridy pre-filled syringe every 14 days. Do not share your Plegridy pre-filled syringe with anyone else. By sharing the needle, you may give an infection to them or get an infection from them. Keep the Plegridy pre-filled syringe and all other medicines out of the reach of children. Next, it's time to get ready for your injection. Find a well-lit, clean, flat work surface like a table and collect all the supplies you will need to give yourself or receive an injection. The items you'll need are a Plegridy administration dose pack that contains one Plegridy pre-filled syringe and a 23-gauge 1 1/4 inch long sterile needle, one alcohol wipe, one gauze pad, one adhesive bandage, and a sharps disposal container for throwing away used syringes and needles. Take one Plegridy administration dose pack out of the refrigerator and let it come to room temperature for about 30 minutes. Do not use external heat sources such as hot water to warm the Plegridy pre-filled syringe. Check the expiration date printed on the Plegridy pre-filled syringe, Plegridy administration dose pack, and the outer carton. Do not use the Plegridy pre-filled syringe past the expiration date. Once you have collected the supplies you will need, wash your hands thoroughly with soap and water. After 30 minutes has passed, the Plegridy pre-filled syringe should have come to room temperature. Next, check the syringe. The syringe should not have any cracks or damage. Check that the cap is intact and has not been removed. Plegridy should look slightly clear, colorless to slightly yellow, and should not have any particles in it. Do not use the Plegridy pre-filled syringe if the syringe is cracked or damaged, the solution is cloudy, colored other than slightly yellow, or has lumps or particles in it, the cap has been removed or is not tightly attached. If you cannot use that syringe, you will need to get a new syringe. Contact Biogen Support Services at 1-800-456-2255. After you've checked the syringe, with one hand, hold the Plegridy pre-filled syringe right under the cap and with the cap pointing up. Make sure you are holding the Plegridy pre-filled syringe by the ridged part directly under the cap. With the other hand, grasp the cap and bend it at a 90-degree angle until the cap snaps off. Open the sterile needle package and take out the covered needle. Hold the Plegridy pre-filled syringe with the glass syringe tip pointing up. Press the needle on the Plegridy pre-filled syringe glass tip. Gently turn the needle to the right, clockwise, until it is tight and firmly attached. If the needle is not firmly attached, it may leak, and you may not get your full dose of Plegridy. Do not remove the protective cover from the needle. Now that you've seen how to prepare for your injection, it's time to get started. If you're using Plegridy for the first time, your healthcare provider may have prescribed you the Plegridy titration kit. The titration kit helps you slowly increase your dose when you begin treatment. To slowly adjust your dose, you will use the Plegridy titration kit with the Plegridy pre-filled syringe for the first 2 doses. For the 3rd dose and every dose after that, you will inject the full dose of Plegridy using the Plegridy pre-filled syringe without using the Plegridy titration kit. If you are switching from subcutaneous Plegridy to intramuscular Plegridy, you do not need to slowly increase your dose again. Your healthcare provider will tell you how much Plegridy to inject and how often to inject Plegridy. Do not inject more than your healthcare provider tells you to. The titration kit contains 2 titration clips that are for single use only with the Plegridy pre-filled syringe for intramuscular use that can be found in your administration dose pack. Do not reuse the Plegridy pre-filled syringe or Plegridy titration clips. Each titration clip has a collar on top that will stop the syringe from injecting a full dose. The collar makes sure that you receive the correct dose. Choose the yellow clip to give a half dose on day 1 for your first injection, and the purple clip to give a 3/4 dose on day 15 for your second injection. You will take your full 125 microgram dose of Plegridy without any clips on day 29 for your 3rd injection and for every injection after that. To attach the titration clip to the pre-filled syringe, start by putting the correct titration clip on a flat surface with the door open. Line up the Plegridy pre-filled syringe over the titration clip with the plunger pointing to the left and the needle pointing to the right. Push the Plegridy pre-filled syringe down into the titration clip until both ends snap into place. Using 2 fingers, push the door down until it closes over the Plegridy pre-filled syringe. You will hear a snap when the door is closed the right way. Do not open the door after it is closed. Check to make sure that the Plegridy pre-filled syringe is in the titration clip the right way and that the door is tightly closed. Now you're ready to give your injection. Remember, your healthcare provider should show you or a caregiver how to prepare and inject the dose of Plegridy before the Plegridy pre-filled syringe is used for the first time. Your healthcare provider or nurse should watch you inject the dose of Plegridy the first time the Plegridy pre-filled syringe is used. Inject your Plegridy exactly as your healthcare provider has shown you. The following steps apply whether you are injecting Plegridy using the titration clips or taking the full 125 microgram dose of Plegridy, except where noted. Intramuscular Plegridy is injected into the muscle and should be injected into the thigh. Rotate your injection sites for each dose. Do not use the same injection site for each injection. Do not inject into an area of the body where the skin is irritated, reddened, bruised, infected, or scarred in any way. Choose your left or right thigh and wipe the skin with an alcohol wipe. Let the injection site dry before injecting the dose. Do not touch this area again before giving the injection. When you're ready, pull the protective cover straight off the needle. Do not twist the cover off. With one hand, stretch the skin out around the injection site. With the other hand, hold the syringe like a pencil. Use a quick, dart-like motion and insert the needle at a 90-degree angle through the skin and into the muscle. Once the needle is in, let go of the skin. If you are using a titration clip, Make sure that you slowly push the plunger all the way down until it touches the collar. If you are injecting the full 125 microgram dose of Plegridy, slowly push the plunger down until the syringe is empty. Pull the needle out of the skin. Press down on the injection site with the gauze pad for a few seconds, or rub gently in a circular motion. If you see blood after you press the injection site for a few seconds, wipe it off with the gauze pad and apply an adhesive bandage. Next up, what to do after your injection. Now that you have successfully given yourself an intramuscular injection using the Plegridy pre-filled syringe, let's discuss what to do after the injection. Do not recap the needle. Recapping the needle can lead to a needle stick injury. Put your used needles and syringes in an FDA-cleared sharps disposal container right away after use. Do not throw away loose needles and syringes in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic or metal, such as a detergent bottle or coffee can. Can be closed with a tight-fitting, puncture-resistant lid without sharps being able to come out. Upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your sharps disposal container. There may be state or local laws about how you should throw away used needles and syringes. Do not throw away used Plegridy pre-filled syringes and needles in household trash or recycling bins. For more information about safe sharps disposal, and for specific information about sharps disposal in the state that you live in, go to the FDA's website at www.fda.gov/safesharpsdisposal. You will also want to record the date and site of your injection in the Plegridy planner included in your welcome kit. This way, you can keep track of when your next injection should be. After 2 hours, check the injection site for redness, pain, itching, swelling, tenderness, a break in your skin that becomes blue and black, or drains fluid. If you have a skin reaction and it does not clear up in a few days, contact your healthcare provider. Ways to help minimize injection site reactions after your injection include gently massaging the injection area, cooling the injection site after the injection by placing something cold on it, like a gel pack, asking your healthcare provider if applying a topical treatment may help relieve rash or redness. We hope this demonstration has been helpful. Review it whenever you need a refresher on how to use your Plegridy pre-filled syringe for intramuscular use. If you have any questions about your injections, please contact your healthcare provider. Nurse educators working on behalf of Biogen are also available 24/7 to provide support, answer your questions, and schedule additional injection training in person, virtually, or over the phone. Call 1-800-456-2255. What is Plegridy, PEG interferon beta-1a? Plegridy is a prescription medicine used to treat relapsing forms of multiple sclerosis, MS, to include clinically isolated syndrome, relapsing remitting disease, and active secondary progressive disease in adults. It is not known if Plegridy is safe and effective in people under 18 or over 65 years of age. Important safety information. Who should not take Plegridy, PEG interferon beta-1a? Do not take Plegridy if you are allergic to interferon beta or PEG interferon or any of the other ingredients in Plegridy. What is the most important information I should know about Plegridy? Plegridy can cause serious side effects, including liver problems or worsening of liver problems, including liver failure and death. Symptoms may include yellowing of your skin or the white part of your eye, nausea, loss of appetite, tiredness, bleeding more easily than normal, confusion, sleepiness, dark-colored urine, and pale stools. During your treatment with Plegridy, you will need to see your healthcare provider regularly. You will have regular blood tests to check for these possible side effects. Depression or suicidal thoughts. Symptoms may include new or worsening depression, feeling hopeless or bad about yourself, thoughts of hurting yourself or suicide, irritability, getting upset easily, nervousness, or new or worsening anxiety. Call your healthcare provider right away if you have any of the symptoms listed above. Before taking Plegridy, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression and suicidal behavior, have or had liver problems, low blood cell counts, bleeding problems, heart problems, seizures, epilepsy, thyroid problems, or any kind of autoimmune disease where the body's immune system attacks the body's own cells. Have or had an allergic reaction to rubber or latex. The tip of the cap of the Plegridy pre-filled syringe for intramuscular use is made of natural rubber latex. Are pregnant or plan to become pregnant. It is not known if Plegridy can harm your unborn baby. Are breastfeeding or plan to breastfeed. Plegridy may pass into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take Plegridy. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Plegridy? Plegridy may cause serious side effects, including serious allergic reactions. Serious allergic reactions can happen if you take Plegridy. Symptoms may include itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, feeling faint, anxiousness, skin rash, hives, or skin bumps. Talk to your healthcare provider before taking another dose of Plegridy. Injection site reactions. Plegridy may commonly cause redness, pain, itching, or swelling at the place where the injection was given. Call your healthcare provider right away if an injection site becomes swollen and painful, or the area looks infected and it does not heal within a few days. You may have a skin infection or an area of severe skin damage, necrosis, requiring treatment by a healthcare provider. Heart problems, including congestive heart failure. Call your healthcare provider right away if you have worsening symptoms of heart failure, such as shortness of breath or swelling of your lower legs or feet while using Plegridy. Some people using Plegridy may have other heart problems, including low blood pressure, fast or abnormal heartbeat, chest pain, heart attack, or a heart muscle problem, cardiomyopathy. Blood problems and changes in your blood tests. Plegridy can decrease your white blood cells or platelets, which can cause an increased risk of infection, bleeding, or anemia, and can cause changes in your liver function tests. Your healthcare provider will do tests to monitor for side effects while you use Plegridy. Thrombotic microangiopathy, TMA. TMA is a condition that involves injury to the smallest blood vessels in your body. TMA can also cause injury to your red blood cells, the cells that carry oxygen to your organs and tissues, and your platelets, cells that help your blood clot, and can sometimes lead to death. Your healthcare provider may tell you to stop taking Plegridy if you develop TMA. Autoimmune diseases. Problems with easy bleeding or bruising, idiopathic thrombocytopenia, thyroid gland problems, hyperthyroidism and hypothyroidism, and autoimmune hepatitis have happened in some people who use interferon beta. Seizures. Some people have had seizures while taking Plegridy, including people who have never had seizures before. The most common side effects of Plegridy include flu-like symptoms. Many people who take Plegridy have flu-like symptoms, especially early in the course of therapy. These symptoms are not really the flu. You cannot pass it on to anyone else. You may be able to manage these flu-like symptoms by taking over-the-counter pain and fever reducers and drinking plenty of water. Flu-like symptoms or other common side effects of Plegridy may include headache, muscle and joint aches, fever, chills, or tiredness. These are not all of the possible side effects of Plegridy. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information and medication guide via the link provided. This information does not take the place of talking with your healthcare provider about your medical condition or your treatment.